Coronavirus has now become a global emergency and everyone is afraid. Emerging from China, this disease has spread to more than 20 countries. Having no cure for this disease has made it even more dangerous. Tashdile, this is Sakina Bhatt and you're watching In Conversation with Tibettv. For this episode, our conversation is on coronavirus, and joining with me for this conversation, I have Dr. Tenzin Namdon from Delek Hospital and Dr. Tenzin Lhundup from Mentseekhang. Welcome to our show, Dr. Namdullah and Dr. Lhundup. So Namdullah, recently there have been many planes landing in Delhi, bringing about hundreds of Indians from Yuan, China, which is actually the epicenter of this disease. And the people in Delhi are already wearing masks and taking precautions. So Delhi being very close to Dharamshala, do you think that we should be at that stage wearing masks and taking precautions too?
So they recently, two planes have arrived from the Wuhan city of China, which is the epicenter of the coronavirus that's occurring. And so hundreds of, in each plane, about 300, more than 300 people have landed in Delhi. And so all these people have been quarantined, basically, which means they have been medically isolated and their movement have been restricted and are under supervision by doctors, looking each day as to see if they have signs and symptoms of the disease and are being tested for the virus at the same time. And as of now, they have no case have been identified from them. But still, I feel that looking at how rapidly in a short span of time the disease has spread, not just within China, but all around the world. So I think that it is very important that you take all the preventive measures.
Okay, so Dr. Lhundup, Mentseekhang has always proved very effective when it comes to medicines because their medicines are very strong and people receive it very well. So what is the understanding of this disease in terms of Tibetan medical perspective?
The medicines of the Mentseekhang has been very effective in the treatment of chronic diseases, and for this case our understanding is that it is one of the types of the 18 contagious disorders that has been stated in the medical text of Gyushi and also in the supplementary text of Lhundup. So our understanding is we term such epidemic or contagious disorders as Nyerim, which means like viable kind of a microbes, which are harmful for the body. And one of the known microbe is known as Parpata. So this Parpata. So these Parpata microbes can once get inflicted in our body, it can affect the metabolic heat, thereby increasing fever or bodily heat in the body at the very instantly. And then the resultant, there is liver and gallbladder impairment, functioning impairment, and then the person who are affected will show symptoms of kind of a severe pain as well as kind of a mental kind of a trauma, or we would say like mental irritation would be there. And then this virus, or for us it is like Nyen, so it can affect the bodily metabolic heat, as I already mentioned, and then it affects the sweat gland as well. And then successively, the three principal bodily energies, which is Lung, Tipa and Pagan, that get disturbed. And successively, that is also through this kind of a 6 modes of disease entrances in our Sovarika system. So there's successively kind of a disease progressions, and we call this Nyen Rim, which is Rimba is one after another. And in our understanding, there's if the person is infected with such Nyen Rim, then he will have also potential to pass or get spread the disease. So this is our understanding, and the novel 2019 novel coronavirus should be part of this 18 types of Nyerim as per our text.
Okay, and many people are saying that this disease is actually emerging from the animal, from the markets that sells live animals. Is it true?
To begin with, so just to brief about the virus itself. So this coronavirus, it actually belongs to a large family of viruses, which is of different types. So we know that about 7 types have been identified, including the newest novel coronavirus of 2019. That infects the human beings. So out of these, usually it produces different kinds of respiratory illnesses and sometimes gastrointestinal diseases. But the respiratory illnesses that it usually produces can vary from mild to severe diseases. So, but generally it produces a mild disease which can range from simple flu-like symptoms like common cold to pneumonia, severe pneumonia, and some severe acute respiratory syndromes which have been earlier caused by other types of coronaviruses like SARS and MERS or coronavirus earlier in 2003 and 2012. And so what happened was in December 2019, a cluster of people in Wuhan city of China, they were suffering from pneumonia, and all of these people were associated with these seafood market and live animal market in the city, Wuhan city. And upon investigating further, it was found that this pneumonia in them was caused by a new type of virus which was previously unknown, and that they termed it as a novel coronavirus 2019. So basically, to talk about the origin of the viruses, it's believed that most of the coronaviruses, they circulate within the animals, wide range of animals from cattle, bats. So all these wide variety of animals, it circulates within the animals, and sometimes it can, very rarely it spreads onto human beings. And that can occur because of various factors. Either there is some mutation in the genetic structure of the virus, or it could be because of some increased contact between the human beings and the animals, that it spreads, the virus is transmitted into the human beings, leading to the diseases. So, but the actual origin of this particular virus, it's still yet to be determined.
So we know that it's coming out from the animals, but we don't know which specific animal is it coming from.
Yeah. So basically, it's believed that the origin, it started from the animals and spread on to human beings, and then from human beings, those people who were sick, from those sick people, it spread on to their close family members, then to healthcare providers who've been taking care of the sick people, and then from people to people, a lot of cases have been identified.
So how do we know that we are infected with this virus? What are its symptoms?
So for us, this infection, it has to be understood through the nian that I mentioned, which is related with kind of a viral or bad microbes. Then it is also related with the heart disorders, as well as then the lung energies in the body get disturbed. So the primary symptoms of having this nian rim is like the person has like severe pain. So if the nian rim has been affected the lung, then the person will have like difficulty in breathing, and then also like severe upper back ache and so on. And if the nian it affects the kidney kidney organ, then it will also like show impairment in the kidney function, and then pain in the lower back area, and then also kind of a urinary obstruction can also take place. So our understanding is that like general symptoms of nian, it's like common cold like symptoms, so having chill, joint pain, and the patient also has like loss of appetite, and then and as I mentioned, like mental confusion or irritation is, has been considered quite common symptoms in such cases. Nian rim, it's such a kind of emergent, it's very challenging because such kind of a disorders is like complex. It is very complex and complicated, because if such hot nature kind of a contagious can appear cold outside, whereas cold nature of the contagious disease can appear outside like hot. So it's very challenging for the clinicians. And also, since the nian rim once affected, it immediately kind of depletes the bodily constituents. So and the patient may feel very tired, they're kind of a loss of energy, and so on. And then also it is very important in the sense that the treatment is very complicated, and it's also such Nyirim can also affect the population and kill, like 1/4 of the population can get killed if this kind of a Nyirim inflicts upon humanity. So as per the text, it's advised to seek more on to look more on the preventative methods rather than curing the disease.
Dr. Namdon, how about you?
So basically the symptoms can vary from mild to severe case symptoms. So in mild symptoms, most frequently that's seen in people is fever, cough, and difficulty in breathing.
These are the basic
These are the basic 3 symptoms. Along with this, you can have other flu-like symptoms like running nose, blocked nose, sore throat, malaise, tiredness, weakness. This can be there, and then ranging from mild cases, it can go on to severe cases, leading to severe pneumonia, then requiring admission to the hospital, and then multi-organ failure can happen, kidney failure can happen, and then finally leading on to death of the people can happen and have been reported.
So Mentseekhang has introduced really effective medicines earlier when SARS had happened in 2002, and when there was this plague after the Gujarat earthquake, and these medicines proved really good and they were in high demand. So what is Mentseekhang doing now in terms of preventing from this disease?
Yeah, so in order to prevent this epidemic, so Mentseekhang is right now very busy in manufacturing large numbers of Rimsung Ribu, we call it.
Rimsung Ribu.
Yeah, so this can be like a protective pill for contagious disorder if you translate literally. So this Rimsung Ribu is on very high demand at present, and Mentseekhang also has invited 20 nuns from the Domaling nunnery to volunteer for covering the pills. Rimsung Ribu, I would like to stress that it is not for consumption, but rather it has to be wear around the neck, and one should smell it intermittently as much as time and place permits. You can see the Rimsung Ribu is covered with the black cloth and tied with the 5 color strings, and it has its own significance because the black color is so strong that it can like divert of the negative influences, or even if it can absorb this kind of microbes, thereby killing it. So, and the 5 color strings, it represents the 5 elements, which is the basic principle of Soarikpa as well as our Tibetan astrology. And these 5 color strings, it also symbolizes the blessing of the 5 types of Buddha nature, or Gyawa Rekna we call it. So usually Rimsung Ribu, how, if you're interested how it can work, actually there's some kind of a peoples are not kind of aware how can it work effectively like that, So for such those interested ones, I would like to stress that these medicines works by the order. When we say it's through the order, the ingredients used in the Rimsung Ribu are of like having strong order by itself, and such ingredients has also this kind of antimicrobial properties.
What are the ingredients?
So like ingredients in the sense it's mainly one of the main ingredient is garlic, and then we have this sulfur as well, and some herbs which are having a very strong aroma. Just like we have this air purifier or kind of a mosquito repellent. So with this idea that the surroundings, we have to think of the patient as individual, and it's individual kind of a world, where the person breathes in. Such air gets kind of a cleans, or like by driving away the microbes, or either the microbes get killed. And another one, our pharmaceutical department has come up with this new herbal product, which is called Nevo Dusi Thikpa, which means like protective liquid balm, So this balm also includes the same kind of a strong ingredients having strong odor as well as antimicrobial properties. And this has to be applied or rolled over one's nostrils, so that because we consider the nose, like to be the gateway of the
Very sensitive.
gateway of all the kind of microorganisms. So to block this kind of a gateway, so application of this protective liquid balm will be very helpful. And also Mentseekhang has been manufacturing one amulet called Pagyo Sungkhor, mainly aimed for like swine flu in the past, but it still can be very helpful because 2019 novel coronavirus could be also part of the one of the epidemics, or so this amulet can be also very helpful in warding away these obstacles from the disease, obstacle from the kind of a carrier. So every obstacles, specifically obstacle caused from the disease condition. So this amulet will be very helpful. At the same time, wearing such amulets, we really believe that it will give us like secure and kind of a safety feeling in this vulnerable time like that.
So I think it's very important to let the viewers know that the Mentseekhang Rimsung Ribu, it's actually meant for wearing or either for smell, because usually when you give a tablet to a person, they usually think that it's meant for consumption, but then the medicines that you are producing for this disease is not for consumption, but it's for wearing and for smelling, right?
True. So actually I believe like those Tibetans, who are like having little closeness with one's culture, so they sure be knowing that Rimsung Ribu is not for consumption. And we can see the sale, how it gets on sale, because we do give instruction. Those interested people who wants to get Rimsung Ribu, they do know that it is for wearing and not for oral consumption.
Exactly. What should be done by an individual who know that they are affected by this virus?
So a person who has symptoms of cough, fever, difficulty in breathing and other symptoms that I've mentioned before, and has a travel history to China or other places where the virus has been isolated, or he or she has come in contact with a person who has such travel history, or the person has been, there's a history that the person has been working in a hospital setting where they're taking care of people who are having these severely acute respiratory illnesses. So all these people, high risk people who have these symptoms, the key to this is to seek medical attention as early as possible. And those who are infected, after seeking medical attention, they should as far as possible stay at home and not go around in public places. And they should also practice these standard hygiene method practices, that is to wear a mask and to while you cough or sneeze, always either cover your mouth or use a tissue, and wash your hands regularly after before you eat food, after you use washroom. So hand washing, so all these standard hygiene practices have to be maintained by that individual.
So basically it's an individual responsibility.
Yes.
What about you, Lhundup?
For us, nearing that it gets spread from infected person to another, in that understanding, it is only through this airborne kind of a disease. So wearing a mask would be very good preventative methods. And at the same time, the such epidemics can be also spread through in contact with the infected person or infected contaminated object. Frequent hand washing would be very good. And those already infected, they must first of all, I would say, like, if they have this kind of a basic knowledge, general knowledge on this disease, it would be helpful for themselves. And then quarantine and others getting medical attention at the earliest time would be very helpful for the patient themselves. In the allopathy one, as if I'm not wrong, is there has not been any particular cure for this epidemic, but in Savarikpa, our clinician can prescribe some anti-inflammatory or some symptomatic relief, and thereby also we can encourage patients to have like this optimistic and be kind of a hopeful in this difficult situation for them. our clinicians can also give some kind of a dietary advices, specifically those inflicted with such epidemics. They should avoid like dairy products as well as any kinds of sweets are not good, because these they can like they give strength to the microbes like that.
The sweets.
Yeah, sweets and dairy product. And having this kind of a heart disease and associated with lung, and the patients should avoid taking red meat or even hot nature kind of a food. They can kind of increase or elevate the inflammation in our body. And on the lifestyle basis, the patient should be his body, mind and speech should be in peace as well as in harmony with nature. And strenuous exercises or activities is also very restricted in such epidemic. If they get quarantine, it's very best for them and for them as well as others. But in case still if those infected who haven't seek the medical attention, they must know that they should at least get in touch, and then they themselves should confine as much as good, or they can stay under a shady tree or some nearby the rivers, so that overall his kind of a own natural immune kind of a fighting can take place.
So people with a disturbed mind and a weaker immune system are likely to get infected by such disease.
Yes, definitely. Those like older people as well as infants, they are at high risk. But in adulthood, also those persons who are like having risks of TIPA and TUG dominant kind of a personalities, so they should be also vigilant specifically at this time.
Okay, so as of now, at this stage, what should an individual do to prevent ourselves from this disease?
So I feel before knowing the preventive measures, I think it's important to know how the virus actually spreads from person to person. So its mode of spread, basically it's thought just like other kind of virus causing respiratory illnesses. It's thought to spread through the droplet infection that an affected individual produces while he or she coughs or sneezes. Or it could be because of touching of these all the things that have been contaminated with the viruses. So since these are the mode of spread, so basically the main preventive measures is to practice the hand respiratory hygiene and safe food practices, so which basically includes adequate and frequent hand washing for at least 20 seconds with the soap and water. And if soap and water is not available, then you can use alternatives like alcohol-based hand sanitizers, but the percentage of the alcohol should be at least 60% to be effective. And then along with this, what other measures can be taken is whenever a person will cough or sneeze, always to either use a handkerchief, and then after coughing, you can just discard it in a closed dustbin, and or what you can do is you can cover it with a flexed arm. So always very important to use a flexed arm so that the virus doesn't spread, go onto your hands and then further spread. And along with this, then other measures is to wear a adequate proper mask that covers your nose and mouth adequately. And another preventive measure is always to avoid touching your eyes, nose and mouth when your hands are unwashed, and avoid close contact with animals, unnecessary contact with animals or animal products. And also sick patients, if avoidable, it's better to avoid close contact with sick people. The food practice is also very important. All these animal products, be it meat or dairy products, it should be adequately cooked before you consume. And all those objects that you frequently come in contact with, like doorknobs or the table, that all those frequently that you come in contact with, these should be frequently disinfected by using the simple disinfectants that you use at home. So these are some of the measures that can be taken by yourself so that you can keep yourself protected. And if you have the disease, then you'll stop it from spreading it to other people.
Exactly. Dr. Lhundup.
As per the Savarikpa approaches, it has been stated that once the epidemic or even be it like a tuberculosis condition, so those caregiver or some health professional, it is important that they should have like adequate this meal on time, like on fasting. If they see patients or if the caregiver gets neglected on not having taking meal on time, so during that time, the person is at very high risk of getting infected. So it's important to have like adequate meal on time, not to remain on fast, as well as hydration is very important, specifically hot boiled water or luke boiled warm water. This would be very good to maintain hydration. And then we call it like sem shumba, where the person it's like a little depressed or worrisome, so during such period it's better to avoid contact with the infected person. And on the individual kind of a preventative method, it would be good, like as we discussed earlier, wearing a rimsung ribu or wearing amulet, then also applying the protective liquid balm. We do have some medications that is also sold on like over the counter, like the case of Tritang. Tritang can be very good in eliminating this infection and inflammation in one's body. And then we Tibetan are also quite familiar with the kyunga, which is known to relieve infection. So consumption of these on daily basis would be also a good options to get prevented oneself. And in our culture, using of incense, incense and incense powder burning, and then this would be like acting as like as we discussed, like mosquito repellent, purifying the air. And then we have like one precious pill called Rinchen Mangjor, which specifically is good for poisoning of any kind, be it like food or from the outside or even a dog bite, So, and this foreign body kind of a virus inflicted in our body. So this taking Rinchen Mangjo weekly once would be very helpful. And then we have this mani ribu and dusichumen. So people, those who consume on regular basis on with small amount of this will be helpful in protecting oneself.
Okay, so how much time do you think that it will take for this virus to die down?
So at this point of time, to just exactly give you a time as to when it will, when the outbreak will end, it's very difficult to comment because it's a very new emerging virus, and we're seeing that every day the number of confirmed cases with coronavirus is increasing. So as of 4th of February, almost there are about 20,600 people globally all around the world that have been infected with the virus. These are confirmed cases, and of these, majority, about 90%, are in the are within China, and rest, the remaining 10% is in all around the world. Almost 23 countries as of now has been infected. So, but most of the experts, they're just saying that this outbreak can lead to two scenarios. First, it could be that the this, just like how it happened with the SARS coronavirus back in 2003, which also originated from China. This virus, after a few months, it could settle down completely because of the quarantine and the airport bans that the Chinese and other countries are, these methods that they're applying. So these, the virus can come to a halt, this outbreak can come to a halt, and the virus can get extinct, and there will be no new cases of the particular coronavirus in the future, just how we have seen in SARS. Or there could be a second scenario where after the outbreak that's currently going on will settle down, but it will remain endemic, which means that it will remain at low, the virus will remain in the environment in not the high number as it is right now, but it will keep on coming seasonally every year in the form of, it will settle down and it will come in the form of respiratory illnesses, which can vary from severe, mild to asymptomatic cases, but it will come on every seasonally, as how we have seen with other varieties of coronaviruses.
Dr. Lhundup.
So I'm just optimistic, and I also agree with Dr. Namdola's first opinion. So with the Chinese government on the global image, and also China being a developing country, and it's kind of on the perspective from the humanitarian or health or financial. So Chinese government is doing its best to try to help its people. So day before yesterday, I came to know that a 1,000-bedded kind of state-of-the-art facility hospital was constructed in 10 days. So that was a record in the world itself. So, and this hospital was mainly to receive those infected novel 2019 coronavirus. So I'm just optimistic that this epidemic could come to an halt with the support from the governments, from the WHO itself, and also we will see like less kind of a human loss in near futures.
Thank you so much, Dr. Namdon and Dr. Lhundup, for this informative knowledge about coronavirus. Thank you for coming to our show.
Thank you.
Thank you so much for watching, and see you in the next episode of In Conversation with Tibettv.